speaking of politics and COVID, di ba, yung
Oo nga.
may medical practitioner na sumasabak sa politika, yan ang dapat natin
Yan ang
kausapin.
segue mo.
Oo, yun. Pagtutugmayin natin niya. Kaya ngayon po, let's begin tonight with 2022 Partido Reforma Senatorial Aspirant Dr. Minguita Padilla. Good evening, Dr. Padilla.
Good evening.
Magandang gabi po.
Welcome.
Good evening, everyone.
Ay,
Thank you for inviting me. Yes.
Apo. Ay, Dr. Padilla, sige, we'll ease into the political side. We'll start with you wearing your doctor's hat. Let me ask you first how you feel about, the trends right now. Una-una, bumababa yung numbers. On the other hand, that's coming out of a long weekend also. So we do anticipate that may have had some impact. But at the same time, the bigger things, we're now considering face-to-face classes. We're moving to reopen the economy. Dinadagdagan ang capacity ng transport. Siksika na ulit sa mga bus. Traffic na naman sa kalye. Ang daming tao sa mga malls.
Tapos next week, may pelikula na.
No. So how do you feel about
yeah.
everything right now as a doctor?
Actually, as a doctor and as a person who's been helping the business sector as well from the beginning, and as somebody who's keeping up to date with what's happening with COVID, you have to remember, Metro Manila we've got at least, because 90% of the target population has been vaccinated. And we have many people who have had the infection without even knowing it, and they have antibodies. I'll tell you that. They did a study in preparation for a clinical trial for Clover vaccine, and they were surprised that in 7 Metro Manila cities and 2 in the cities in the outskirts, 65% of adults who never had vaccinations were already positive for antibodies, for neutralizing antibodies. In other words, they had COVID, they got well. You add that to the vaccines, to those being vaccinated in Metro Manila, and I wouldn't be surprised, I'm not saying we are, I wouldn't be surprised if we're reaching the point of herd immunity. Because we have so many people who got infected na hindi nila alam. Okay?
Natural
and hindi nagre-report.
immunity.
Natural
Yeah,
immunity.
in
Because
short.
you see, you get herd immunity 2 ways, vaccination and natural. So we're not saying you have to go for natural. Definitely you should get vaccinated, but it is a factor. And that is why we're seeing the numbers going down, because we're aggressive in the vaccination. There's no other way. Okay, now, because of that.
Are you saying,
Yes.
wait, but are you saying that that's something that the government never measured? Is that a
Yes.
vital point of information that
Yes.
we should have factored in, that we didn't?
Yes, we should have. It helps because, especially at the early point where we were lacking vaccines, no? That's why these people needed to study who already had COVID, who had none, no? But in some countries, for example, Israel, France, and other countries, and even Singapore for a while, nung kulang pa ang bakuna, they were able to ramp it up. Why? And to expand the number of vaccinees. Why? They took into account who had it and who had antibodies. Because those people, many studies have shown, 1 bakuna lang is enough. So you can spread the vaccines more. They're doing that as a method to spread the limited vaccines. Okay, in a world where the rich countries have so much vaccines and the poor countries don't have enough, that's useful. However, now, if we are to believe government, and I think Secretary Galvez is telling the truth, we have a lot of vaccines just lying around not being used. No? But let's go to that later. What's happening now in Metro Manila? Am I in favor of easing? Actually, I am. I am in favor, but this curfew, maybe not the curfew yet, okay? Because sometimes when you say no curfew, the people get lax, okay? I want the easing. I want removing those plastic barriers that really don't help. They really do not help. Even face shields, many of us are questioning them because face shields are meant for droplet transmission. Like you're a doctor, you're seeing a patient, bubugahan ka ng laway, ng kung ano-ano, no? But for, what you call this, if it's the air, it may end up even in the face shield. It may end up even in those barriers. So if you're in a public transport, it was us actually who was really telling, our group, the doctors, the experts were telling the IATF, can you please remove those barriers? They might even add to the problem than help. Okay? They may be a repository of the viruses. Now, there must be ventilation. What's important is ventilation. Tuloy-tuloy yung hangin. Kahit air condition yan, kailangan may hangin all over the place. At hindi magsasalita, hindi magkakwentuhan, hindi kakain sa transportation. But I believe 70% muna, wag naman full. Okay? And wag muna yung siksikan.
Okay.
Okay?
Doc,
Just no standing. But I think we're ready to open up, at least in Metro Manila. We
Doc,
are.
Doc, if you don't mind, I'd like to go back to your Clover study, yung 65%.
Yeah.
I find that fascinating kasi
Yeah.
it never occurred
Yeah.
to us na ganun karami yung
Yeah.
nakakuha ng virus na hindi nalaman
Yes.
na asymptomatic. Yung
These
65% po,
yeah.
is it possible
Yeah.
at all? Is it possible to extrapolate that to a national level? Kasi here you're talking about 7
Metro
cities in Metro
Manila.
Manila and 2 other areas
Yes.
outside Metro Manila.
You know, we were hoping early on last year, a group of us led by former Health Secretary Manolet Taylit, and I was one of the people, the co-investigators, we were trying to get a seroprevalence study among a lot of towns in Luzon, not just Metro Manila, to see ilan na ba talaga ang nagka-COVID. Pero we did not get support from the government. And that's really sad, no? And a lot of scientists were hoping we would. So it's called seroprevalence.
Yeah.
Because it will give you a better idea of how many talaga got the infection. Because right now, we don't know. In India, for example, remember there was this Delta surge where they were dying in the streets, being burned na lang in the fires in the streets. Remember that? And bigla now, they're better. Then they said 90% of the Indians have antibodies because of their surge. So they're vaccinating like anything, but at the same time, a lot of them are already seropositive, meaning SERO positive for antibodies. So my point is, it is a nice way to see, ano ba talaga, where are we now? Because there are some people who are there are some economies that are being held down, and they say, walang bakuna, baka isa lang ang kailangan mo because your antibodies will rise if in the same level as somebody who's never had the infection, who has 2 vaccines, and you who've had the infection, kahit isang bakuna lang, nakikita, it will go to the same level. In other words, you don't need 2. That is one way of using the information to spread out the vaccines. That's if your vaccines are limited, which it was for a long time. And I don't know if we really have enough, but they say we have enough now. If you have enough vaccines, then just do the 2 vaccine thing for a double dose and 1 vaccine with a single dose. But if you don't have enough vaccines, that is one way to spread the vaccines, okay? It's a very nice thing to know. Ilan na ba talaga? You know, because they say we only are reporting what, 1/10, 1/5? How many are really getting reported? Many never report that they got sick because they're afraid to report. They just hide in their homes, diba? So you know, there are many things that, you know, but we could do, but they're saying it's expensive. We don't know which antibody tests are really helpful, et cetera, et cetera. So, but this is one data which we're missing.
Okay.
Doctor, which government agency did you approach for this?
Well, actually,
For the study?
no, it has finished already. The study had been already finished. The clinical trials for this vaccine. It was a vaccine trial, okay? In several, well, the one who was reporting to us was Dr. Lulu Bravo. She was in charge. You can ask her. No?
Because you've been reported as saying that you find the pandemic response poor. Can you be more specific
Well,
about
yes.
or inadequate?
Poor.
So,
No. Yeah.
can you be more specific about it?
Okay. No, I was saying that there was a lack of a sense of urgency. It was basically that at the start, and this is from the very beginning. You have to remember that it was March 2020. We also found out that there was no reporting, or there was a lack of transparency. We were not told that there was already community transmission when there were already COVID patients in the hospitals or in ICUs. We didn't know, the doctors. We were sitting ducks. That's why many doctors died early on. That's one. There's lack of transparency. 2 is they did not close borders as soon as they should have. There was a slow response. No, they were still thinking of hurting the feelings of China. 3, we were not ready with the testing. We had, you know, there was like so lackadaisical. Oh, we have 2,000 test kits. That should be enough. You know, it was not enough. People were dying before they even knew if they had COVID. So there was a lack of urgency, no? And to the point that the private sector, it's a good thing the private sector was there, and the doctors in both public and government hospitals, kami na nagre-raise ng funds. We were the ones raising funds to get the PPEs, et cetera, et cetera. So we were like scrambling. So we felt there was a lack of a sense of urgency. Then the vaccines. Okay, the vaccines. The vaccines, we could have got them earlier. And I think it's been talked about, dropping the ball, etc. No? And then overpricing. I know for a fact things were overpriced. Even the testing was overpriced. And if it were not for the pagkakulit ng private sector, the PCR test would be 8,500 pa bawat test. And it went down and went down. So my point is, and then the vaccines, the price of the vaccines. Until now, this is November 3, 2021, we still don't know how much government paid, really
Yeah.
paid for the
Dr.
Sinovac vaccine. So hindi pa, lack of transparency. So when you have that, there's a lack of trust.
Okay.
And when there's a lack of trust, you have a problem, even with implementing vaccination. So, that's sunod-sunod.
Dr. Padilla, we will get into all of those details, but let's just signal it very clearly. We're now asking you, as somebody who's running for the Senate.
Okay.
Well, let's start with that. Why? I mean, obviously.
Why what?
Why run for the Senate? I mean,
Okay.
I mean, in this past 1.5 years, we could sense naman you're very open about your frustration, your questions, and
Yes.
so on. But why run for the Senate? How much of a difference do you think that makes?
Okay. Well, okay. If you were to ask me, I would probably make a bigger difference if I were Secretary of Health, because you could really do something. But then again, you depend on the president. How do you know the president will want you to be Secretary of Health, or you even have the same ideals, the same passion for, the same political will? So the Senate, okay. I have been an advocate for health for the past maybe 26 years, 27 years. And I've been working with senators, with congressmen, and we advocate. We tell them everything we feel has to be done. But at the end of the day, it's still up to them. And many times it can be frustrating, okay? We see a lot of the laws that we helped to pass through our technical working groups, etc., not being implemented properly, and yet there's no oversight. Nobody's telling them, "Oy, mali yan." But we doctors, we live through it. No? I work in Philippine General Hospital. I cater to the even the poorest of the poor and the most desperate. I also work in a private hospital, St. Luke's. I see the extremes. Okay, I teach also in UP. We see the patient's needs. We see how the laws affect us. If you are just making the laws and you don't live in the trenches the way we do, it's hard to really understand how your laws affect us and what needs to be fixed. And we know which are being implemented properly and which are not. And so and then I've been in PhilHealth. I worked in PhilHealth 1.5 years, the latter part of the Aquino administration. And we tried to effect a lot of reforms, and we did. But there's so much that has to be done in PhilHealth.
Yeah.
And look what's happening now. They're not paying the hospitals. We know, I kind of know how to solve many problems. But if I'm just an advocate, I don't have much of a voice. But if I'm in the Senate, I will have the floor. I can have more influence, maybe.
Could I start with one example that you cited? High prices of testing kits, high prices of vaccines, overpricing. Let's throw Pharmaly in there and the face mask. With your decades of experience, is that a problem just now? Or is that a chronic problem in our public health environment?
I believe there's overpricing. It's a chronic problem in the Department of Health, and I'm very sorry to say this now, but there have been so many how do you say this, anomalies or things that are not really run the way they should. Even in the supply chain management, there's very so much to be desired. Why buy expiring medicines at regular price when they should be 30% off? Things like that, no? And we hear about it, but we're not in there. We can't really do anything about it. Now, this Pharmaly thing, what makes this extremely horrible, no, is the fact that it happened during a pandemic when people were dying. There was desperation among the people. People were suffering. And that's why it's extremely painful, no, for the healthcare workers and even for the patients themselves. Corruption has been happening in every administration. But parang to see it happening this way, no? Yung garapalan talaga, yung pagpapayaman, as they say, no? Habang nagdurusa yung karamihan, it's like you wonder what kind of souls they have. Because and then we were there scrambling for PPEs, using garbage bags, while all these deals were going on. And there were delays. Why were there delays? And I can tell you, there was a tug of war between those in government who were earnestly doing their job and those who were trying to make a profit. So I'm sure there was some form of overpricing happening. I don't have all the data, but this time I know there was. And it was a time of desperation. That's why this is what makes it extremely, difficult for us to take. And we cannot ignore. And maybe because we've turned our backs too long, we turned a blind eye too long on corruption, parang it became, commonplace, just how it's done, and with more impunity. No? Parang, I see, okay lang. So it became commonplace, even in the time of suffering and in the time of pandemic.
In terms of laws that you feel you ought to be pushing once you become senator, if you become senator, no? How else can you improve on the Universal Health Care Act, for example, which is now law? And if you follow the provisions, actually, it's not a bad law at all, no? Especially as it legislates a national insurance system, which has yet to materialize. No? But what exactly can you do if you sit as senator to make sure that this law is actually enforced to the letter and according to the intent for which it was actually passed?
Okay, that's a good question. There are two elements. One is PhilHealth and one is the UHC law itself. Okay, PhilHealth is the carrot and the stick of the UHC. Without a good PhilHealth, it's impossible. Okay, the UHC law, part of it tells us that PhilHealth will be increasing our premiums that we pay every year, every so often, until we're paying 5% of our salary. No, if you make 100,000. For me, that has to be put on TRO muna, hold muna, because I know for a fact PhilHealth is not collecting properly. Why are we are going to suffer. The people who are paying, the ordinary employee is going to be paying more. Kakaltasan mas malaki. While inside PhilHealth, they're not even collecting properly. It's a very small percentage of what they should be collecting. Some of it goes to the treasury, some of it does not. Some of it goes somewhere else. Okay? There's so much that has to be fixed inside. There has to be an
So
audit.
you're saying
Yes.
it's okay. So it's the
Corruption.
problem, one of corruption.
One of
more
corruption,
than
one.
lack of enforcement or funds for that matter.
That's one, no? That's one. And the system, okay? There must be an audit. We should make it a law. There must be an audit, regular audit of an independent body that will audit not just the finances of PhilHealth, but the IT system and their legal system. Because those are the two most problematic divisions of PhilHealth. The IT system, a lot of hospitals are complaining they're not getting paid. But if you see the records, it's as if they're being paid. What's happening to that money? Why is it like that? And I know that this government for a while tried to audit them, but they didn't allow themselves to be audited. How can that be? They cannot say don't audit
But
us.
Doc, hindi
There
ba trabaho
must
ng,
be
ano,
a-
ng,
a
hindi ba
audit
trabaho ng
then.
COA yun?
Yeah, but
No.
that's not the job of a senator unless
No.
you're
Not the center, but there must be a law to make sure there's an audit. It's not COA. COA audits the finances, audit the IT system, an independent IT expert, the information technology. They must be able to open it up. The law has to be amended. It's not in the law. There's no transparency. They don't have to. There's too much secrecy inside PhilHealth, what's going on. Because you see, PhilHealth is a quasi-judicial. They are the investigator, they are the lawyers, they are the judge of everything, okay? So we have to look into all of these things, no? Because
amend that law.
we have to look into the law, and we have to see also how it's being implemented, because a lot of hospitals are also complaining on how it's being implemented, and I agree, no? For example, there's abuse. There's a lot of populism. The intention of the universal healthcare is this: no Filipino will go into financial ruin or just because you got sick. Okay, now the idea is prevention. The idea is in every barangay you will have your free maintenance medicines, your hypertension medicines, diabetes medicines, etc. So you don't end up having renal failure. You don't end up having a heart attack. You prevent that. You prevent hospitalization. But if you need to be hospitalized, there's a referral system, referral network, so you can get into a hospital assigned to you. Okay? Then after you're through there, you go back. If it works, it's beautiful. It's beautiful, no? And if you go to a basic package, you don't pay. It's only if you get more than the basic, then you pay a copay. And the copay should be at least something predictable. Maganda talaga ang intensyon ng universal healthcare. But then, this is it. We can help our LGUs achieve that, especially since the Mandanas ruling of the Supreme Court will be in effect, okay? And EO 138 has been signed. So that money should go to them. However, there must be oversight, very close oversight, and the Senate can do that, of how it's being implemented. There must be accountability, there must be deliverables, and we must see that if we give you this money, ito ang deliverables ninyo. So it's full devolution of the funds, okay, finally, not just the functions. Before it was just the functions.
If there are
Yeah.
funds, but ang problema ho
Yeah.
kasi lagi ng insurance, wala namang pondo, no? As a
this is
matter
not
of
just
fact, I
insurance.
remember
Yeah.
President Duterte saying, okay, so now I have signed the Universal Healthcare Act, pero walang pondo. But that's the problem of the Senate, no? So where do you get the funds? I mean, the
Okay.
plan is good, and the law is
Yeah.
good, but where do
Okay.
you get the funds?
No, it's not just the funds. I'm not talking about PhilHealth. PhilHealth is just one aspect. I'm talking about the taxes. Because now, with this Mandana's ruling, the money that goes to the LGU is not just their era. So they're not limited to their poverty. It's the entire tax net, the taxes of the entire country, including customs, will now be divided. So each one will get from the taxes. This is iba pa sa PhilHealth ito. Iba pa sa PhilHealth, okay? This will help with the funding of the hospitals, with the funding of agriculture, etc. But we have to watch how this is funded. I mean, how this is implemented, because you can always, use it for corruption. So ito oversight ito. Congress must have an oversight over this, to see. You can see, and I think there should be a hall of fame and a hall of shame, as far as LGUs are concerned. So there people know, teka, itong LGU magaling, itong amin hindi, bakit? No? Ito yung pera na nabibigay. There must be transparency of the funds. No? And the PhilHealth naman goes into when you're utilizing the healthcare. The taxes, regardless of whether healthcare is being utilized, it will go to you. So you can improve your hospitals, you can improve, etc. You can buy medicines. No? PhilHealth is the payer of the utilization of the professional fees, of medicines used, etc. There's so much you can do, but it's oversight. Okay, it's oversight, and we have to review the existing laws because there's so many laws, but they're not being implemented or not being implemented properly. So they keep making new laws, but not really checking on the implementation. Medical, PWDs, etc. Even organ donation, they're not really checking if it's really happening. So I think first we have to have an inventory of so many laws, because why make new laws when it's there but not implemented? And we know in the hospitals which are being implemented and which are not. No? So we need to look into that. So madami.
Yeah, especially in pandemic. Yeah.
Oh, one more thing, Luchi, you are talking about pandemic. No? We have to make ourselves ready for the next pandemic. That can be legislated. No? I think it's very important that we as a country, we are ready for the next pandemic, not like what happened to us when this struck, no? And we can legislate those things. And then we can also legislate education for the children, no? DepEd, especially even digital education, so that they're not as gullible to fake news as they are now, not as gullible to being victimized by predators in the internet. There's so much we can, and then we can also increase the capacity for virtual diagnosis and virtual consultations, because it will solve a lot of our problems of lack of doctors in the barrios if we can maximize virtual. So ang dami pwedeng gawin actually.
Okay.
So,
Dr. Minguita Padilla, unfortunately, we've run out of time. Dr. Padilla, maraming salamat po. Dr. Minguita Padilla is running for senator under the Partido Reforma. Maraming salamat po.
Ingat po.
Thank you.
maraming salamat
Thanks,
din sa
Doc.
inyo lahat. Bye-bye. Good night.
We'll need to take a break. Please stay with us. The Chiefs will be right back.